Welcome back. Joining us today is Megan Pierce, pediatrician and asthma specialist at Children's Hospital at Erlanger here in Chattanooga. And we're going to talk about asthma and the effect it has on kids in school. We'll give you a phone number and everything. Welcome to our program.
Thanks.
Is there any difference between, children that have asthma attacks at school and those at home or out anywhere else?
No, pretty much every asthma attack is pretty much the same. It just depends on where it's happening. There are different triggers that bring on asthma attacks, and some of those can be brought on at school, and some of those, happen at home. But really, they can happen anywhere.
Yeah, anywhere, and that's, I guess, not good, is it?
No, it's not good. Yep. Asthma is the most common reason for children to miss school during the school year. Yep, and they've estimated about 14 million missed school days a year across the country from asthma. And, it's not only the missed school days, but you also have to think that the parents are also missing work because of that. So it's a huge, huge cost and burden.
Goodness me. What is asthma? What happens when a person has an asthma attack?
Sure. Asthma, I really like to think about it as a chronic disorder. And so a lot of people don't understand that, asthma is actually not kind of a come and go problem. And people don't realize that there's a lot more than just that come on. Asthma is a disorder of basically inflammation inside the lungs. And I have a pediatric asthma clinic at Children's Hospital, and the way that I like to explain it to parents and to patients is to kind of think about it if you have a cut on your arm and the cut is always there. Sometimes you might hit the cut on something and then the cut will bleed, and that's kind of more like the attacks. Those are the symptoms. But if you don't treat that cut, to get it to go away, then it's always going to be there. So sort of the same thing inside the lungs. There's chronic inflammation that's always sitting there in the lungs, and then one of these triggers comes along and basically kind of exacerbates the problem, and then that's when you get muscle tightening inside, and that's when you have the coughing and wheezing that's associated with it.
And it's very important to do what if your child or adult even has an asthma attack, right?
The main thing is you need to control the inflammation. And so the medicines that a lot of people usually know of are albuterol, which are the quick reliever medicines. That medicine only helps one part of the asthma. That's only treating the muscle tightening inside the airways. It's not treating the everyday chronic inflammation. And so if your asthma is bad enough where you're having lots of attacks, or you're missing school days, you're missing work, you're not sleeping at night because you're up coughing all night, or your child's up coughing all night, you really need to treat the inflammation. And usually that involves reducing exposure to triggers, but also typically long-term controller medicines that you take every day to prevent these attacks from being so bad.
Is enough being done to be able to perhaps someday find a cure? Or is it one of those that's been around forever and will stay?
Asthma has been around forever. There have been lots of more diagnoses, it seems like, in the last 10 years. The percentage of asthma has just skyrocketed in the past 10 years. Around 25 million people, about 12 to 13 million of those kids are diagnosed with asthma. So it's about 1 in 10. So if you think about a typical classroom, between 2 to 3 kids in every classroom is asthma. But lots of research is going into trying to find a cure and a better treatment.
An attack is caused by 3 changes: swelling in the airways, excess mucus, which blocks the airway, tightening of the muscles.
Yes.
All that, it tightens.
It tightens, yep. And the tightening is the kind of the part of it that sort of comes and goes. The rest of it is pretty much there all the time. So, the muscle tightening is what gives you the symptoms, but, all of the under the surface stuff is kind of there every single day. So kind of just waiting for one of these triggers to come along and set it off.
Whew. Mercy. Thank you very much.
Good news is we have good treatment.
I can't ask for anything better than that, that's for sure. More information, you can call this number, 423-778-LINK, 778-LINK, or you can go to their website, which is Erlanger.